morning, everybody, and welcome to another episode here on the Digital Trade Show podcast. Super excited to be with you live from Columbus, Ohio at the ADHA annual session. And this morning, I am very excited for our next guest, Jahn, who is the Director of Professional Relations and Education. That's a lot of stuff. At Waterpik, which is such a popular product with hygienists, and they've had a lot of buzz at their booth and all that. So I wanted to have her come on, talk about some of the exciting things that you're doing at Waterpik. So thanks for coming on the podcast.
All right. Well, thank you, John, for inviting us. We're super happy to do it. And we love talking about Waterpik. We love hygienists. I'm a hygienist.
Okay.
So I started my career as a clinician, and I joined Waterpik 22 years ago after being in clinical practice for 14 years. And as I tell everyone, I must have been 12, right, when I started.
That's right.
It's
That's
gone
good.
that quickly.
That's good.
And it's fun. It's not even, like work. And so a lot of what I do is interact with hygienists, dentists. I do newsletters. Anything that we do a lot of science surrounding our product. Yeah. But we always want to take it and we want to make it understandable. But more importantly, we want to make it clinically applicable, and so that's where I think a lot of the education comes in. What's this mean for me? What's it mean for my patients? So I work with our Lunch and Learn program. I do our newsletter. I do continuing education courses myself. Yep. I write them. Anything that we can think of that just helps elevate people's awareness and knowledge about the water flosser and be more comfortable and confident recommending it.
Yeah, I think it is so cool when people like yourself who practiced for many years makes the decision to work together with a company, because as you know, Carol, it's that educational piece that a lot of times puts the product over the line, right?
It does,
like when a practice is trying to make that decision, they're like, yeah, I saw the marketing piece, had the features and benefits, that's fine, but where's the science, where's the research and all that, or what have you, and certainly to have you do that. So I'd love to learn a little bit about, I know you kind of talked about what you do, but let's go back a little bit to, your decision when you did start to practice, and then your decision to want to get into this world to work with Waterpik.
Okay. Well, I went to the University of Iowa, and I had, great mentors and instructors. As I was getting ready to graduate, one of them said to me, "You're going to come back here and get your master's and teach." And I graduated in 1982, so some of your world was, you taught, or maybe you went into public health. Not very many people were going into corporate, exactly. So it was always resonating for me. I loved clinical practice. I loved my patients. Probably the pivotal piece is association involvement, working in my local group, becoming the president of the Illinois Dental Hygienists Association. You get your skill set, you meet other people in the industry, and I knew I was ready for my next step, which was to get a master's degree. And I took a long time to figure it out. I don't think I necessarily had corporate intent at the time. Right. I thought, I'd love to give continuing ed. I think I'll practice clinically. But one thing about education is then you get into a program and then your world really opens up on possibilities. And I happened to see an ad in the Journal of Dental Hygiene for an educational representative. I was about a year into my master's degree, and I read what they said, and I thought, wow, that's just what I'm doing right now. That's what I'm going to really be able to do. I'll apply, but I'm a year in. It'll just probably be a really good learning experience for me. They won't hire somebody who doesn't. I got the job. And
here you are.
And here I am, and I finished my degree. And as a lifelong learner, you never stop learning. And all the things that change. So that's, how I got to this point. You didn't hear the keynote. One of the things Michael Jr. said today is you have to know your why. And things that I say to people when they're thinking about leaving clinical practice is I've always said to them, figure out your reason for being. If you understand your reason for being, everything else flows. So my reason for being is I loved helping people, I loved helping patients, and I still do that with Waterpik. I still help patients have better oral hygiene. Right. And if I help a hygienist help a patient, then my mission is complete.
Yes. Well, certainly I can tell there's a reason why they've had you around for a long time, and your passion is infectious. And I think that, again, a company establishes the brand, they establish the product, then they bring in people like you and add that educational component, which I think is so awesome. So talk a little bit about the show. How's it been? I always love to hear the conversations that you guys are having with hygienists, the questions they're having. Waterpik's been around for a while.
We've been around since 1962.
So you're having to figure out new ways, especially if you don't have loads of products. So how have you guys been able to keep it fresh, and what are some of the conversations that are being had at the booth?
Well, the most exciting conversation we're having these days is about our newest product, which is called Sonic Fusion. It is the world's first flossing toothbrush. So we have long had water flossers. I think our one of the key things we've done with water flossing is we've refined, we continue to have the science. We have science that shows it works as better than string floss, so that's appealing. We have worked on our products to make them as user-friendly as possible, but this product is just a game changer. It allows you, it's a toothbrush handle, so it's something everybody does. Not everybody will clean between their teeth, but almost everybody brushes their teeth.
Right.
And we hear people don't floss because, they don't want to take the time, or they
Sure.
don't want to do something. We live in a world of convenience. How convenient can you make it? So you push a button to brush, you press the button below it, and water comes out of the water flossing tip on the brush head. And so without doing anything else, you're able to start water flossing. People say it's a brush. I think it's a water flosser that happens to be a toothbrush. It allows you to do both of those things at the same time. You can do them separately. You can do them whatever phase you want. The clinical science showed it was twice as effective as string floss at reducing bleeding, gingivitis, plaque. So we have confidence. We have the ADA seal on that product and many of our products showing it's safe and effective. So I think that, we've had so many people say, I'm getting this for my husband, or
Right.
I have a patient in mind this is for, or they want to try it themselves. And I'm really happy. It's exciting. I've been using it since January. Of course, I started out on a prototype. I thought, I love water flossing in my power brush. I'll be wanting to know this for recommending. I love it. I absolutely love it myself. So I think that we're really good at trying to figure out what's going to help people, what's going to make it easier for them.
It's interesting because as you're saying that, I'm thinking to myself, okay, so I brush, and then it only takes me probably 10 seconds to reach over to my drawer,
Right.
pull out my floss, but I
Right.
gotta do all this or
Right.
whatever, and that may not seem like a lot of time, but to
Right.
your point,
Right. It's an extra step.
it's an extra step.
It's
So-
just, this is the push of a button.
Yeah, so you guys have been able to do that. Well, that's
Yeah.
awesome. And how long have you been a member of the ADHA?
Oh, 36 years. We just
Okay.
talked about yesterday. I was in product presentation. We were all saying how long we'd been members. Since 1982 when I graduated. I was a student member before that.
Yeah.
I've been coming to this meeting. Next year the meeting's in Louisville, and I said, wow, my first ADHA meeting was in Louisville, which might have been 90, 91.
Really?
I'm not sure, something
Awesome.
like that.
Awesome.
Yeah.
Well, I live in Louisville, so we're
Ah,
really, really
yeah.
excited that it's obviously going to be in the hometown.
It's exciting.
Next year. But, I mean, how much has it changed? It's amazing, I'm
You're
sure,
right.
from your perspective, just the evolution. And I think what's been encouraging, at least from my vantage point, to sit up here with a lot of people that have been coming to this for a long time, is the amount of that you guys are giving back.
Right.
With a lot of the younger, newer hygienists, and certainly them finding mentors. It's really encouraging. It's been nice to see.
Right. They have a community day. They have a day of giving. I think that the meetings are, the continuing ed is superb here. The opportunities so two of my coworkers that are here are their team leaders for our Lunch and Learn program, and they're not hygienists. And both of them commented last night that how empowering this felt to be here as a woman, because everybody just, I met someone on Thursday at a Lunch and Learn, and she's like, I'm by myself, and I've never come to this meeting, and the other person and I are like, well, don't worry, you're not alone, you're with us, here's our cards, you
Right.
want somebody to do something.
Right.
People embrace each other,
Yeah.
they lift each other up, and it gives you that reason for why, as for being a hygienist. People who come here don't view themselves as people who clean teeth.
Sure.
They view themselves as oral health care, or healthcare providers in general, and where we're going to go and how much we can do. And so it's a way to recharge your battery.
Yeah, absolutely.
Always. That's one thing that's never changed since
Yeah.
the first meeting I went to, is you walk away from here having a renewed sense of your purpose and what you do.
Sure. Well, and again, I think it's very encouraging to see. I'm sure many of you had mentors when you first started,
Absolutely.
and people, and I think it's really super cool for a lot of the younger hygienists to realize, wow, I mean, look at what these women
Right.
are doing to make the industry better, and they keep coming back,
Right, and
which is a great
we want
thing.
it. We want to put our hand out. You're our future. We
Sure.
want you to be the
Yeah.
next wave and do it and love it like we love it.
Yeah. So, tell me something, I guess, other than the exciting things about Waterpik, which certainly are, of maybe one thing just that's going on in dentistry right now that you're really excited about.
Well, there's a lot of, things. Sometimes we think things aren't changing and that. But one of the things that I've been reading about lately that has been very interesting and exciting for me, we've known for a long time about the link between oral and systemic health, and we focused on cardiovascular disease and that. But more and more, I'm reading about things like people with poor periodontal health have a greater risk for numerous types of cancers. Particularly, we've seen colon cancer or pancreatic cancer, and in some cases they're finding that some of this oral bacteria is found in the colon, and where's the digestive tract start? Right in the oral cavity. And so as we look at some of that, there's a lot of interesting things, I think, going on in that realm. I found it
well, and
interesting.
what I find out from a lot of people that I speak with, and you'll know this, it's not like this is new.
No,
it's been
it's
around
not.
forever.
Exactly.
It's just somewhere along the line, somebody must have figured out. I always think maybe the day that they decided to have the dental practice away from the hospital, for whatever reason, that meant that people thought that then the mouth was not connected to the rest of the body.
Right, exactly.
Just because of where you went to go get those
Right.
things taken care of. But it certainly is encouraging. And, we spoke with, a couple women yesterday, Erin Howlett, who's doing some
I know
things with
Erin.
the
She's great.
Wellness Network and
Yes.
some things that they're doing because, as you know, it's one thing, as I'm sure you see this with Waterpik, they can buy the product
Right.
or give it to their patients, but then there still is always that application part to make sure
Right.
they're using
They
it
have to
right.
use
And,
it.
and sometimes if people don't know that, they get discouraged, they don't use and all that. So that implementation part is very, very important, and it's nice to see that we're seeing that done.
Right. One of the things that we try to do, one of the things we believe in is not just the education, but we try to get dental professionals to use our product. Most people have flossed, right? That's a no-brainer. But not a lot of people have used the water flosser. But I say to them, once you use it, then you are going to be so much better at helping your patient understand how to use it. You have so much more credibility when you use it. And I also know once they use it, they're going to be hooked.
Sure.
Because it's just an amazing feeling, and we hear that all the time.
Yeah.
So it's great.
Absolutely.
I was going to say that there's a great book out there, Teeth by Mariotto, and she talks a lot about how that division of medical and dental occurred, 100 plus years ago.
Okay. I'm very curious about that. Yeah. Because again, a lot of the people that I got the opportunity to interview, there's so much talk around it, and we always kind of look at each other, and we want to understand the why. Why did it ever get like this?
Well, I think too we don't do a lot about wellness and quality of life. They don't. Medicare does not pay for dental care and it does not pay for hearing aids. If you have any aging parents, those kind of things. It doesn't pay for hearing aids. It doesn't pay for vision. And another low priority is mental health. Yeah. So it's, maybe if you have, heaven forbid, a brain tumor, they pay attention to something above the neck.
Sure.
But some of these other things that can make people age better, give people better quality of life, perhaps help children learn better if they can see or hear, or not have pain from teeth. We don't really put a lot of good thought and information and money towards that as a country.
We're moving in that direction.
Yeah, we are,
I think
hopefully.
certainly
I hope so.
because of a lot of people like yourself and people in the industry that are taking it very seriously and forming these great networks like the ADHA and a lot of the continuing education that you're doing.
I think the boomers will drive it too.
Oh, there's no question.
Yeah, they're going to, what their wants and needs are going to say, wait a minute.
Yeah.
Yeah,
and maybe there's some money there, so hopefully they'll figure it out. But all right, so a couple fun questions for you. So if there was a song that best described your career.
Oh, my career?
Or a genre of music, what would it be?
Okay, well, when you had, or somebody had said, you're going to ask me, if Waterpik were a song, what would the song be, right? So I send this email out, and my boss is laughing. He goes, more people responded to that than they'll respond to other things. So we had all this fun stuff, and all these songs, and I'm like, oh, that's a good song, and that's a good song, and what should it be? And then last week, I'm driving back from Father's Day, and I'm listening to the Tom Petty channel, and I hear, Won't Back Down. And I thought, that's our song. And that could even really be personally my song. And he's like, I'm standing at the gates of hell. I'm like, you try to tell somebody that a water flosser is better than string floss? Sometimes it's like standing at the gates of hell. They're like, I don't believe you. And And yet we keep doing our research. We believe in our product. We know we can help people, and we've never backed away from any of those things. So there's that. And then one of the other funny things I have to say, because we don't back down, is because one of our digital people said the song should be "I'm Never Gonna Give You Up" by Rick Astley. And I said, well, that's because once they use a water flosser, that's their song. I'm never gonna give you up. And so I think those are kind of
I love that.
Yeah.
Maybe like at your next national sales meeting.
There we go.
We
can play that music,
Tom Petty.
Yeah, exactly.
And
right.
Rick Astley.
Right, exactly. We'll satisfy everybody because I'm kind of an '80s, and all that stuff.
Sure. How about you've had the opportunity to travel, I'm sure, with your work or what have you. Is there a place in the world you haven't been yet that you'd like to go to?
Yeah. In fact, it's funny. I wish I wanted to be here, but I also wanted to go to Europe, and Amsterdam, which is this weekend too. I've been a lot of places, but I've never been to Amsterdam, and I'd like to go there. And there's, the world is an amazing place to see, So I'm sure I could think of other things, but that's the one that's sort of at my list right now.
I love it. All right, so you being an educator and all the places that you've been, I'm sure you get this opportunity, but when you're standing in front of a group of young hygienists that are getting ready to start their career or what have you, one bit of advice that you would share to them, giving everything that you've learned in your career?
Some of the things I've said to them is everybody gets so, for obvious reasons. You got board exams coming, right? You're afraid you won't pass your boards. What if I can't, I don't remove all the calculus and I don't scale the teeth? And I'm like, you know what? Almost everybody passes their boards. Almost everybody does. You learn to scale teeth. But what's harder for us to learn is how to influence our patients' behavior. How to get them to floss or water floss or use an interproximal brush or whatever it is. And so don't wedge yourself to floss. Don't wedge yourself to one single thing because you're always going to be pushing back. If you can broaden your horizons, if you can think about what I can do to help that person, that might be a water flosser or it might be a soft pick from Sunstar or anything else. You're going to get more satisfaction. You're going to be happy. You're going to go home less tired at the end of the day.
Yeah. I love that, and this has been awesome. Thank you so much for taking it over this way.
Yeah, all right. Thank you as well.
But yeah, good luck, and so excited to see what you guys are doing. And for everybody, please, take some time, learn more about Waterpik, the all the great stuff that they're doing. And Carol, just thanks for what you do for the industry. This is always a pleasure to be able to speak with people like yourself. And good luck with the rest of the show.
Well, thank you. You too. It's been a pleasure.
All right,
Thanks.
take care.